Okay, so third video here is going to go over the vasculature of the heart. And so since the heart itself does not receive nourishment from the blood moving through the chambers, the heart has to have its own circulatory system. And so what we're going to cover right now is going to be exactly that. So off of the aorta here, we're going to have two branches. We're going to have the right coronary artery, and we're going to have a left coronary artery, which is hidden by the pulmonary trunk, but we can see the left just a little bit right underneath here. Okay. So the right one comes down and it will feed the front side of the heart here on the right-hand side. And so this first branch that we're going to label is going to be the right marginal artery. Okay. And as it comes around, just turn it this way, number 61 here is going to be the posterior descending artery. Okay, so from that right coronary artery, we're going to have two branches. We're going to have the marginal artery here, and we're going to have that posterior descending artery on the back side. Off of the left coronary artery, it bifurcates here and becomes the anterior descending artery, or the anterior intraventricular artery, and then it wraps around through this side here, coming underneath this auricle, and the red one here becomes the circumflex artery. So off of the right, we have the marginal, and we're going to have the posterior descending, or the posterior intraventricular artery on the back side. And off of the left coronary artery, we're going to have the circumflex that wraps around, and then we're going to have the anterior descending artery, or the anterior intraventricular artery. Okay. Some of the other vessels that we can see on the heart here, we have these pulmonary veins coming in on the left side here, and over here on the right-hand side. And then we're going to have the pulmonary arteries that are going to the lungs on the right and on the left. Okay, notice that this is the only time that on our models that the arteries are blue and the veins are red. And that's because of the blood oxygenation that they're carrying. So here the arteries are carrying the blood away from the right side, which is deoxygenated, and the left side is going to be the oxygenated blood. Okay. Off of the aorta here, we're going to have the aorta, we have the ascending, we have the arch here. Back here we're going to have the descending portion. Off of the aorta we have three different branches. We're going to have this right side, which becomes the brachiocephalic trunk, which then splits and bifurcates, becomes the carotid arteries going to the head, and then the subclavian arteries going down to the right arm. The left side is a little bit different because we don't have a brachiocephalic trunk, but we're going to have two separate vessels. The middle one here, number 14, will actually become the left common carotid, going up to the head, feeding the brain. And the number 15 here is going to become the left subclavian. So on the left side, we have a subclavian artery, we have a common carotid artery that are separate. And on the right side, we're going to have a branch that is shared at first and then splits and becomes the common carotid and the subclavian. So brachiocephalic artery, we're going to have the common carotid here on the left, and then we're going to have the left subclavian. Okay. Now the venous structures of the heart, the blood coming back into the heart, we have the superior vena cava here, we have the inferior vena cava down here on the bottom. So those are some of the major veins bringing the blood back to the heart. Some of the structures I think that we forgot previously are going to be the auricles, those flaps on side here. So we have the left auricle and the right auricle on this side. All right, so we'll keep these videos, try to keep them short, and then we'll continue on with some more heart anatomy here in the next one.